Welcome to Doctors on Call. I'm Jenna Miller. February is Pet Dental Health Month. According to a national poll, nearly 70% of dog owners would give up their own dental work for a year if it meant their dog could have healthier teeth. More than 50% devoted more time to their pet's dental health during the pandemic this past year. But more astonishing may be the fact that there is actually such a thing as braces for your dog's teeth. Tonight, we'll be talking all things pets, whether that be oral care or general health care, with Hayes veterinarian, Dr. Steve Mosier.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Regional Hospital, experts, neighbors, friends.
Pet health is our topic this evening on Doctors on Call. Please take this opportunity and call 800-337-4788 with your questions. Dr. Steve Mosier completed his Doctor of Veterinary Medicine at the Kansas State University College of Veterinary Medicine in Manhattan. Dr. Mosier worked in Wichita and Nebraska before joining the Army Veterinary Corps. He then joined Hayes Veterinary Hospital in 1970 and became full owner in 1995. Dr. Mosier is a member of the American Veterinary Medical Association and the Kansas Veterinary Medical Association and was named Veterinarian of the Year in Kansas in 2000. Give us a call at 800-337-4788 toll-free with your questions about your pets on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or veterinarian. Thanks so much for joining us again, Doctor. It's good to have you back. Let's go ahead and start with some of our own questions while those calls come in. First of all, let's talk about the main services you provide at Hayes Veterinary Hospital.
I think it has to be the preventive care, starting a new pet, getting on the vaccinations, making sure they get on the right road to a long, healthy life, and then, of course, taking care of emergency type things. If they get sick, taking care of the sick and doing that. So I think those two things are probably our main emphasis.
Can you explain how your emergency services work?
Yeah, we have an answering service that we turn on every night, and the doctors at the veterinary hospital rotate, and it's whoever his turn is up, they'll be on. But at any time, you can get a hold of a veterinarian at the Hayes Veterinary Hospital.
Excellent, very good to know. We were talking about dental care, and February is Dental Pet Health Month. How important is dental care when it comes to your pet?
Really important. You know, and I think we probably see more problems in small breeds of dogs. And I think a lot of that comes from the fact that we have a tendency sometimes to feed canned food and not dry food. Dry food in and of itself has a tendency to clean teeth. And so I think that helps. And I think it's important that in our small breeds that we feed some dry as well as canned. Now, as they get older, dogs, I think, prefer canned. And as they get to old, then a lot of times we'll go to a canned food. But that, I think that's part of the issue.
Is it good to mix them together, or do you feed them separately?
Really good question. I think sometimes if we're going to get them to entice them to eat, I think you need to mix them together. If they're used to it, I think you can feed them separate.
Yeah. Okay. We mentioned braces in the intro. What would be the reason behind getting your pet braces?
We see a lot of dogs that the brachiocephalic, or the short-nosed breed, their teeth don't match at all, and I think it'd have to be just that you would like to have straight teeth there, even though I don't know how important that is. We see a lot of them with teeth going every which way, and they get along fine.
All right, well, we're going to go to the phone lines now. We've got Donna on the line from Atwood. Hi, Donna. Go ahead with your question for Dr. Mosier tonight. Donna, are you there? Must be having a hard time hearing Donna. We'll try one more time. Donna, are you on the line? You must have lost her. Okay. Well, give us a call back, Donna. Okay, we'll just call back Donna. We'll get you on the air here in no time. So how essential are dental cleanings?
Really, we do it as an as-needed basis. You know, on people, you know, they get you on a regimen of, well, we're going to clean your teeth every 6 months or every year or whatever. We don't do that so much. Maybe some clinics do. We don't. We like to look at them and say, okay, we got a lot of tartar, we got some bad teeth, that need to be pulled, and we need to clean the others. So we do it on an as-needed basis. And again, it's as they get older, usually is when you see the problem. But on a young dog, sometimes we'll see some fractured teeth where they bite into something and fracture those. And it's gone to, well, we've got dental specialists in veterinary medicine that will go ahead and put crowns on and root canals. We don't do that. That's kind of specialty. It's amazing to me, though, that some of these dogs that fracture their teeth, everybody worries about that. And they can live with a fractured tooth and not little or no pain. Now everybody says, how do you know that? And I say, I don't know for sure, but they go ahead and eat, and they don't show pain. And so we see some of those that we get along with fine.
Okay, great information. Okay, we're going to go back to the phone lines. We've got Renee on the line from Phillipsburg. Hi, Renee, go ahead with your question for Dr. Mosier. Are you there, Renee?
Yes, I'm here.
Okay, go ahead with your question.
I have a question about osteosarcoma in dogs. What is being done at Manhattan or in K-State on that?
Well, they have an oncology unit that handles most of the osteosarcoma type things. I don't know, and they do a lot of drugs that will help sometimes. Still the first step, usually, unfortunately, is amputation of that limb that has the osteosarcoma. That still is kind of the basis, and then they'll go ahead and come in with the chemo and so on like that. But it's an area of expertise that the K-State does and promotes.
Okay, good to know. We've got Donna back on the line from Atwood. Hi, Donna. Hopefully we can get you through this time. Are you there? Hello, Donna. Are you there?
I'm Renee.
Oh, you're still Renee. Okay. Did you have another question, Renee?
Yes, I sure do.
Okay.
I have almost a 2-year-old Great Dane. In June she'll be 2, and I'm just wondering what the best time to get them fixed. And do you recommend her getting tacked at the same time?
Good questions. We think on Great Dane, probably as far as neutering or spaying, you probably wait till they're about 2 years old. And that's basically because they've come up with new information about what do we affect the joints if we do the neutering or spaying too young. So, and then, you know, there is a procedure where they tack the stomach. We don't do that on a routine basis, but certainly we see enough of the twisted stomachs or gastric torsion that it's not a bad idea.
Okay, we were talking a little bit about the dental health before the phone calls came in. How does a pet's dental health affect his overall health or well-being?
Tremendous. If they get bad teeth and they just get a lot of bacteria, which that bacteria feeds and affects the kidneys and the liver and all over their body, you know. And if a person will, when they get that puppy, start brushing those teeth. You can do it, you know, and if you train them when they're young, it's just like a lot of things. But boy, if you try to do it on an adult dog, they're going to say, I think you ought to forget that, you know, let's not do that. But if you will, and especially again on the small breeds of dogs, if you start brushing those teeth, it can be done, and it's a really good idea.
Now, how worth it is it to get pet insurance?
Good question. If I were living in an urban area where the prices are more than it is here in western Kansas, I would think it'd be essential. I really would. We've had people in this area check into it, and it's not cheap. By the same token, it'll kind of cover major accidents and major illnesses type. And so it's worth looking into, but we kind of take the stand that you look into it. If you decide that's a good thing for you, then go ahead and do it.
Does it work similarly to what a human's insurance, health insurance?
Pretty much. The good part of it is the veterinarian doesn't really get involved. You fill out the form, you sign whatever happened, and the person and the company does all the work. We don't have a whole staff that has to do with the interim type stuff.
How often do you recommend regular wellness exams and checkups?
In young dogs, we have a series of vaccinations and everything. So we see a young dog pretty frequently up to the time they're 6 months old, about 6 months old. So that covers that. After that, probably yearly is good unless something comes up, but I think a yearly exam is probably appropriate.
And are the nutritional needs different for different breeds?
Certainly, you bet. Yeah, I think one of the main things I've seen over the years is when I first got out, the first thing we did on growing puppies, especially large breed growing puppies, boy, we socked the vitamins to them, and we did this and everything to encourage growth. Well, we found out that's not the right thing to do. Probably even some of the big dog breeders or large breed breeders will feed adult food to puppies to encourage them not to grow as fast and affect the joints. So,
okay. All right, well, back to the phone lines we go. We've got Marietta on the line from Dodge City. Hi, Marietta. Go ahead with your question for our guest tonight.
Yes, I have an older cat that I adopted, and he's really a special cat, except that he ends up biting me at times and scratching, and I don't know how to break him of that.
he does what?
Can you repeat what your question is, Marietta? We didn't quite get that last part.
Yes, he bites me and scratches me sometimes.
Yeah.
And when he wants me up in the morning, he'll come in and bite me.
Yeah. Unfortunately, that's kind of an affection type move in their mind. In their mind, they're saying, if I nibble at you or bite you, I can get you up. But boy, it's not very pleasant when you're sitting there, when they're trying to get you up. And the same thing with kind of scratching. And it's hard to break that behavior. I think if you're petting them and everything, my cat will turn around and start to try to nibble. I'll just stop petting. You just stop paying attention. I think you try to avoid that. To try to stop them is really difficult to do. So it's a behavioral thing. And so, yeah, it's tough to deal with, but it is a sign of affection if you can stand that.
How do you feel about decline?
Really good question. I think within 5 years, my guess would be decline will be illegal and not used anywhere. There are several states have already banned the decline. I guess we still take the point that, if that's the only way a person's going to be able to keep that keep that cat, is to have them declawed. And then the people adamant about not doing it. They think that it's a lot of pain and everything. We've kind of addressed that with pain meds and everything. So I guess if a person if you can, you teach them to use a scratching post, and they have the little rubber inserts that you can put on the toes. Those things work not so well in my mind because you're always replacing them. So it's encouraged by the American Veterinary Medical Association that we do not declaw. Like I say, we still will do it on request, but we still try to talk to people about there are alternatives.
And where did that get started? What was the point of declawing a cat?
I think, number one, I always thought the major thing was if you had children, and you didn't want that cat hooking that child in an eye or anything like that. I always thought that was a good point. And then it got to, we got to protect the furniture, so they don't tear up the furniture. And certainly they can do that. But it does take time to get the behavior that you don't have to declaw. So if they ask me, I will say I prefer not to, but I say I will. Yeah.
Okay. Let's talk about feeding your dog. And we were talking a little bit about the dry and the soft dog foods and pets in general. What are some foods that pets should never eat?
Well, you'll hear about chocolate, and everything like that, and raisins and all that. The list grows longer as we go. Those are rare incidences. And then they'll say, you ought to feed just strictly dog food and not people food. That's very difficult to do. You got this little pet, this little Shih Tzu looks at you, and I'll give him a little tidbit. And it's hard not to do that. But we say stay away from pork type products and chocolate, of course, And so that'd probably be the main things I would think about.
Sure. And what are some symptoms of food allergies?
Just itching all over, they scratch and everything. And food allergies are hard to pin down. And they came out what they call grain-free foods. And they said, well, a lot of allergies were due to the wheat or the soy or whatever was in the foods that we have fed for years. And so I think you got to remember that. So a lot of people are proponents of grain-free, and I certainly don't disagree with that. However, we will see some with chronic ear infections that I have seen response to if they will switch that, or if they have a chronic vomiting problem. So I think there is a place for that, but I'm not for sure it's the wherewithal answer to the food allergy problem.
Do you have any cold weather tips for dogs?
Well, I think, if it's the cold that you wouldn't want to be out there, you have to do the shelter. And of course, have plenty of water. I think you just got to look at it like, how would I feel, And there are some dogs that go out on a snowbank and lay there and just really like it. And so you have to adapt with breed and everything like that.
And then on the flip side, with your warmer weather, once the temperatures heat up.
Same thing, if it gets real hot and it's uncomfortable for you, I think you have to shade and water and a place they can get out of the hot weather. Yeah.
Okay, now we were talking a little bit about immunizations. What shots do you recommend for your pet?
Well, on the dog side, we do the distemper, the hepatitis, and the parvo, and then more and more people are adding lepto. So that's on the dog side, plus rabies. Now, they have flu shots for dogs. And about, a few years ago, that came out and was a real issue. And they said that everybody that had dogs that got together ought to be doing flu vaccines. We do it on request. It is not part of our routine as far as using flu shots. Now, some people use it, and I think that's fine, but it's not in our routine. On cats, we do distemper. And now we always call them distemper shots, but they also have 3 of the upper respiratory viruses in that vaccination, rhinotracheitis, Klebsiella, and chlamydia. And so it's not just distemper. And then we also do leukemia. Now leukemia I think is important if that cat is an indoor-outdoor cat and may be exposed to feral cats or groups of cats. And leukemia is more important. If it's strictly an indoor cat, I'm not for sure that leukemia needs to be given, but that's my personal opinion. And then rabies, of course, as well as with the dog.
Okay, we've got another phone call on the line. Here we have Lee from Hayes. Hi, Lee, go ahead with your question for Dr. Mosier tonight.
Hi, yes, we have a 4-year-old Great Dane, and he was neutered, but he was cryptorchid. And our neighbors have an intact female, and he acts crazy when she's in heat. I mean, to the point where he's trying to break through gates and crying continually. And the vet threw a testosterone level, and it was 20, and that was when he wasn't acting up. And he said that it was normal, and I'm just wondering why he's behaving like this, if there's a chance he didn't get that testicle in the belly out, or if some dogs behave this way.
Good question. Yeah, I would be disturbed if that were my dog. And you have to think, was there some extra testicular tissue in there? Was a surgery a complete surgery, and they got that out? You'd have to wonder if one of those things weren't going. The testosterone level being normal, according, and I don't know the 20. That would be beyond me. But it says that probably everything was okay. So you get back to behavioral, but still something has to drive that behavior. So I guess I would probably say check that testosterone level again and make sure, and then maybe have somebody go in and scope that dog in the abdomen and see if there's some extra tissue, and that can happen rarely, but it can.
Okay, we were talking about, before the phone call, the vaccinations. What about a coronavirus? Is there a coronavirus vaccination for pets?
There is, and there are, and we used to use it. it's kind of interesting. It's a different brand of Corona,
Right.
but and then we see a lot of Corona in calves, but in pets we used to have it in, and then the people decided that probably it was not indicated, and so we do not generally use a vaccine that has Corona in it. So, and it caused a mild GI upset is what they thought it did. But yeah, we don't, again, it's not routinely in our protocol.
Now, are there, speaking of which, are there side effects that pets might have after receiving a vaccine?
Really, yeah, there are rarely, and we don't see it very often. Sometimes we'll see an immediate reaction, and I've seen dogs that'll just fall over, and that gets your heart rate up pretty fast, and that's an acute allergic anaphylactic reaction. But then we'll see some, within 2 to 4 hours usually, that their face will start to swell and their lips will get thick and they'll start scratching and everything. So that's a delayed reaction. And again, we don't see it very often, but we always just say, if people call and they say, well, what can I do? We'll say, well, reach for the Benadryl or the antihistamine first. Now, if that doesn't do it, sometimes we have to come back in with some steroids. But yeah. So it does happen, and it's like any vaccination or any injection. There's that potential.
Let's talk about cats and deworming. What needs to be done, how often, and what needs to be done as far as that goes?
Again, it depends, I think, on whether they're strictly house pets or they run the neighborhood, And so, again, we start as a young cats. We do it routinely on young kittens. And then the tapeworm is one, fleas are the intermediate host for tapeworms, as are rodents. So these cats that are out and about, and if they're eating mice, well, they may pick up some tapeworm. Now, tapeworms are little rice-like segments, and you'll see it in the stool, so you'll know that. So I think that's, and the other worms, we do roundworms and hookworms, but yeah, that's the main thing.
How do you administer that?
It's interesting that we used to have just pills or a liquid type thing, and we generally use a liquid to start off with. They've come out with a topical, which is a wonderful thing, and especially in cats, because the topical will not only do the deworming, it will take care of the fleas, and it'll take care of ear mites, which is great if you've ever had to treat ear mites, cats. They don't like to see you come and put stuff in their ears.
Sure. Now, is that something that can be done over the counter, or they need to bring them into the vet to get that done?
So they can do it over the counter. They can come in and purchase that, and there's a lot of products that they have that are exclusive at the veterinary hospitals. But boy, there's not very many anymore. You can go online about anything you can get anymore.
Now, are there ways to prevent diabetes in pets?
Good nutrition, I suppose. I don't know that there are ways to actually prevent diabetes. I think they think it's a kind of an autoimmune type thing where the pancreatic cells don't produce enough insulin, and so they're insulin deficient, and so you have to give insulin. If you keep them in good shape. We will see it more in middle-aged, overweight dogs. We also see it in cats, and I think we probably also see in the overweight cat. So, in answer to your question, probably if you keep them nice and trim, it's going to be the best thing you can do.
Excellent. And then what happens if they are diagnosed as diabetic? Then what's the next step?
We have quite a few that do, and I'm always amazed at people who will take on the challenge of treating diabetic animals, because it is. You're given an insulin shot twice a day, mainly, sometimes once a day, but mainly twice a day. You have to stick to that regimen. You should put them on a diet that's specific for diabetics. Sometimes we don't do that and get along okay. But it is a real challenge, and my hat's off to those people who will accept that challenge.
Sure. What kinds of health risks do aging pets tend to have?
Yeah, aging pets, the big thing that gets most pets, I think, is kidney issues. The kidneys give out and we get into compromised kidney function. And I think that's the main thing we see. Arthritis, of course, is one. And then again, I think obesity, they'll say, is one of the big problems that we see in older pets. And so if we will kind of stick to that regimen, that not to let them get overweight, that the other thing about neutering and spaying is, the downfall is they will usually broaden out and put on weight. And so you got to be really careful after you do that. And we kind of used to say, that didn't happen. Anymore, we know it does, and so we acknowledge that, yeah.
Sure. Now, do senior pets need senior pet food?
They do make it, and they probably should have it. I think there are. It amazes me that everybody keeps coming out with new. And now I think that one day one of these companies are going to come out and say, well, if they're 6 to 7 years old, you feed this one. If 7 to 8, you feed this one. Well, I think that's ridiculous. You know, I think if you have a good quality food and you buy, and by that I mean a mainstream, middle-priced food that you recognize who makes it, I think most of those are adequate foods.
Okay, well, thank you so much for joining us again. We always enjoy having you here. Next time on Doctors on Call, we'll learn more about mental health. You can email questions to us for our next program at doctors@shptv.org by Tuesday at noon. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.